premiums are going to go down. I mean, this isn't a matter of interpretation. It's just the data.
How do you respond? You talked about there's an overlap between conservatives and liberals.
Yeah.
How do you respond to real free market advocates that say medical care should be, health care should be just like any other product left to the free market, and you're a central planner and a socialist when you're monkeying with this stuff?
Even reasonable conservative health policy people don't accept that. You don't have to be a liberal to say you need government in there to regulate. Now let's.
How is it different? What is different about
healthcare? I'll explain. The healthcare marketplace is not like other marketplaces in the sense that you don't go in and buy a medical service. A doctor prescribes a medical service for you, and often doctors are not worried about the cost. And truth be told, lots of surveys have shown doctors have no idea what the costs of whatever they order are, and doctors are not the people who actually pay the bills. So it is a kind of situation where you have a third party doing the buying, and you're supposed to pay the bills. That's just not going to work. If you look actually at healthcare costs, 83% of healthcare expenditures are for chronic illness, and 16%, 14% are for acute illnesses. Now, in a lot of those illnesses, you don't have a lot of options yourself. You're not educated enough to know what the right thing to do is. And we know that when people spend their own money for healthcare without insurance and without guidance, they tend to not get preventative services, which we think are important. They tend to focus on the acute. I've got a pain, I've got to get rid of it. And they don't focus on the long term, like taking medications and being compliant to keep their blood pressure down, even though, for many people that if they don't do that, it's going to turn into a disaster either from a heart attack or from a stroke. So having it as a marketplace will lead to some pretty bad distortions. The final point I would make is most people can't afford it. You couldn't afford it if you had to pay out of your own pocket and there was a pure marketplace like buying a house or buying a car. You have no ability to pay for it. That's why we need subsidies. Even the Republicans, the hard right Republicans, recognize you need refundable tax credits to allow people to buy insurance. And so that's just a matter of fact. We couldn't have a market without giving people help. And let me finish with one last point. If you left it to a free market, I don't know your health, but if you, for example, or your spouse or one of your children had cancer, there is no way you'd be able to afford to buy health insurance. Zero way. You would, on a free market basis, you'd be priced out of the system. No one would sell you insurance. So you leave it to a free market, pre-existing disease exclusions, that's exactly how we got that. You've had cancer, we're not insuring you. Or we'll insure you, that bill, it'll be $45,000, thank you very much. Just not a way you can run a system like that.
So you reject the argument of the Nobel Prize winning economist Friedrich Hayek, who said central planning is fatal conceit. You think you have a better understanding of how to control individual lives and what kind of health care they should have versus the individual doing it? You think you, as an advisor, should be telling legislators how to construct something in your view is better than what I think I need for my health care coverage?
You have no idea what you need, A.
And you know better than I do?
B, you have no idea, you have no ability to afford health care coverage.
Isn't that taking money out of one pocket and putting it into the other? You're taking it from kids and putting it into people who are unhealthy?
Does it involve a redistribution over time? The answer is yes.
So Trump today during his news conference said